Good evening. Today we'll be discussing about anemia in pregnancy. Anemia, according to WHO World Health Organization, is hemoglobin less than 11 gram per deciliter in pregnancy. Hi, I'm Dr. Gitika. I'm consultant gynae in BLK Max Hospital, New Delhi. So today we'll be discussing something about anemia, what are its causes, what are its symptoms, and how do we treat it. In this session, I'll be covering what are the types of anemia in pregnancy. So anemia in pregnancy is very common, and almost 1 out of 2 females, they do have their hemoglobin less than 11 gram per deciliter during pregnancy. It can be physiological, that means during pregnancy, since the blood volume it increases in amount, so this results in hemodilution. This results in drop in the hemoglobin, which can be normal, which is in fact normal in pregnancy. The second type of anemia is pathological anemia, which means there is a cause for anemia in pregnancy. It can be nutritional deficiency anemia. It can be because of other reasons, like some hereditary problem where there is problem in the blood formation, or it can be because of some bone marrow defects as well. So talking about nutritional deficiency anemia, this is the most common cause of anemia in pregnancy. And the most common deficiency which leads to nutritional deficiency anemia is the iron deficiency anemia. Our red blood cells, they contain a protein known as hemoglobin, and this hemoglobin carries oxygen to various parts of the body. So in anemia, what happens? This hemoglobin level falls. This hemoglobin is made up of 4 iron atoms. So if the iron is not sufficient in the body, the hemoglobin will be less. So the lesser the hemoglobin, the lesser will be the capacity of our blood to carry oxygen. That's why we can feel lethargic, we can feel very tired, we will feel pale, and we will have easy tiredness. So the most common pathological anemia is the iron deficiency anemia. That is the nutritional anemia, and in nutritional anemia, iron deficiency is the most common cause. So it's recommended that you should take iron-rich food during pregnancy. Other deficiencies which can lead to anemia is vitamin B12 deficiency or folic acid deficiency. Then there can be some hereditary causes of anemia, and in the northern belt of India, thalassemias, they are very common. Thalassemia is a condition where it is a genetic condition where there is defect in the formation of the hemoglobin chains. So since there is defect in the formation of hemoglobin chains, so there is deficiency of hemoglobin. The thalassemia can be thalassemia minor or thalassemia major. So if your hemoglobin is continuously below a certain range, you should get yourself tested for thalassemia, and all the pregnant females should get themselves screened for thalassemia. This is very, very important, because if a female has thalassemia minor and if she marries if she marries a male who is also thalassemia minor, then the baby can have thalassemia major. So if both the parents have thalassemia minor, there is 1 in 4 chance that the baby can be thalassemia major, where the baby may require frequent blood transfusion. So it's very important that you should get yourself screened for thalassemia. Then the other causes can be some bone marrow defects. Then there are other hereditary causes also, like sickle cell anemia, and other bone marrow causes also, like aplastic anemia are there, or leukemias are there. So these are some of the common causes why the anemia can be there in pregnancy. In next video, we will study what are the signs and symptoms of anemia and how do we treat it. I hope the video was helpful to you. Thank you so much.